fatigue, and then eventually, yung pag may sleep apnea po kasi ang tendency is decrease yung oxygen in our body, that can affect our organs as well. Yung pag-decrease po na oxygen in our body can damage kasi nagkakaroon po ng less po na oxygenation in our organs in our body.
So pag-usapan natin on what those could lead to later on in the show. But most often, the first signs of sleep apnea aren't recognized by the patient, but who they sleep with o kung sinong kasama nilang matulog. And many of those affected with sleep apnea usually have no sleep complaints to begin with. So, Dr. Debbie, let's discuss some of the symptoms first.
So, first and foremost, of course, they will be snoring loud. That can be heard outside of the bedroom, no? Talagang ganun kalakas yung snoring. And then, the effect will be excessive daytime sleepiness. It is actually the most common cause of excessive daytime sleepiness. Yung hindi ka nakatulog ng maayos sa gabi because sa sobrang non-restful ang iyong tulog sa gabi.
Okay, now clearly those with sleep apnea will experience some form of exhaustion the next day. Katulad ng sinabi na Dr. Debbie, no? So parang kahit na nakatulog sila ng ilang oras, pagising nila parang pagod pa rin. Kasi nga, your interrupted sleep doesn't allow for the body to rest. But let's go back to snoring a little bit. To be clear to our viewers, not everyone who snores has sleep apnea and not everyone who has sleep apnea snores. Kaya I'd like to ask Dr. Debbie, paano mo malalaman na ang snoring ng isang tao is something that is serious? Because marami sa mga viewers natin, I'm sure, feel na humihilik sila kapag pagod. Humihilik lang sila when they're really tired or in some instances lang. Paano nila malalaman na normal ang kanilang snoring?
Well, yun, occasionally, triggered lang siya kung pagod ka, ganun. Pero we call it sleep apnea kung talagang every night halos, malakas ka mag-snore, and then your snoring is, after you snore, you are awakened by gasping for breath, or even coughing, snorting, ganon. Kasi talagang hindi na makapasok ang hangin. So the brain wakes you up to resume normal breathing and normal breathing para hinga ka ulit ng maayos.
Let's talk about some of the two general types of sleep apnea. There are actually two types, yung obstructive at yung central. Dr. Debbie, let's first talk about kung ano ba yung obstructive sleep apnea.
Obstructive, as the term implies, merong bara sa lalamunan or sa passageway ng hangin na hindi siya makapasok sa lungs. So it can start from the nose, the throat, and then dito pababa before it enters the lungs. So, ang most common cause dyan will be kung excess weight kasi syempre meron din weight fat dito sa leeg natin. Kaya nagbabara yung daanan ng hangin.
But let's go on naman to yung less common form of this disorder, which is central sleep apnea naman. Ms. Crisel, explain natin sa mga viewers kung ano ba yung central sleep apnea at ano yung mga risk factors para dito?
For central sleep apnea po, it means there is no obstruction but the body basically parang nakakalimutan po siyang huminga. So sleep apnea is a cessation of all breathing. So wala po tayong breathing from the upper airways, wala din pong breathing from the chest. Ang nangyayari po dyan, ang most common po na ano po dyan yung mga
maayong balita sa tanan sa atong panginahanglan sa panimalay, mga gamit, ingon man mga dekorasyon, pwede na natong mapalit diha sa Wellington Bazaar. Anausab sa Wellington Bazaar ang mga bestidahon, karsunison, plain t-shirt, plastic chair, floor mat, mantel, banig, folding bed, habol, mosketero, trapal, lideret, basketball, stuffed toys ug mga dulaan sa bata. Ang Wellington Bazaar ana magalagad kanato sa dalan kaymo ning dakbayan sa Surigao. Wellington Bazaar, gikan sa mga kawani ug tigdumala sa Wellington Bazaar. Mayong adlaw alang kaninyo. Wellington Bazaar, sukion ta sa kanunay.
Ay, kasakit yun sa ako ang mga mata. Uy, labad pagyud kay ako ang ulo. Murag kog malipong ba? Unya, murag limtanon pagyud ko. Unsaon man ni uy?
Naa na yun kay problema, miss. Ha? Tanawa ko, nagsakay ka ng tricycle, wala kay suot bra. Para masolba na imo problema, ha? Pag inuman ni, Lutein Plus.
Unsa? Lutein Plus? Asa man na nimo gikan?
Ako maninadunggan sa radyo, miss. Mao kagapalit ko naan, pagpagandam ba?
Sige, salamat kaayo ha. Magpalit dayon ko og Lutein Plus.
RPN Radio Philippines Network Radyo Ronda DXKS Surigao Member Kapisanan ng mga broadcaster ng Pilipinas.
Many health conditions are linked to sleep apnea, including obesity as well as high blood pressure. Now, these conditions, together with a lack of sleep, can harm different systems in your body. I'm Dr. Freddie Gomez, and you're watching Mental Health Talk on CNN Philippines, where your care always comes first. As we mentioned earlier, snoring is more than just a source of irritation to those sleeping around you. Now, it could mean that you are more prone to having more serious health problems, and one of them is a stroke. Dr. Debbie, could you please explain to our viewers ano yung connection between sleep apnea and stroke?
Maraming connection yan, no? Besides the hypertension na it causes because you are not resting during the night, may mga studies na yung the vibration of the neck muscles itself can cause some problems in the carotid arteries, the major arteries that supply the brain, no? So that could be one possible reason kung bakit na predisposed ka to stroke if you have sleep apnea.
How is sleep apnea? How can it make someone who is diabetic, how can it make their condition worse kapag meron silang sleep apnea?
Sleep should be a time for rest and repair of our bodies, no? So there are systems that should go into play pag matutulog tayo sa gabi, bababa yung mga hormones, ganon, cortisol especially. So kung because of your being not rested during the night, palaging elevated ang mga steroid levels in your body, which is directly related to the development of diabetes mellitus.
I'll ask Ms. Crisel, pinag-usapan ni Dr. Debbie yung mga risk factors ng sleep apnea and how it's related din sa ating heart. So pag-usapan natin yun, how can sleep apnea put your heart at risk?
When we're sleeping po kasi, our heart slows down to parang resting na rin po. Yung pag may sleep apnea po kasi, tendency is magkaroon po tayo ng tinatawag po namin na arousal, ligising katawan nyo. So that sudden arousal po will make your heart pump faster. And also, yung pag-decrease po na oxygen sa katawan, magko-compensate po yung puso. Magpa-pump siya faster. So yung pag-pump niya, mag-overwork, pwede po siya may tendency na mag-overwork. Pwede pong lumaki yung puso. So kung lalaki po yung puso, pwede po tayo magkaroon ng parang wear and tear, kumbaga, sa puso po natin. So yun po, magkakaroon po ng cardiac problems eventually.
Now, Dr. Debbie, anong mararamdaman ng isang pasyente who has sleep apnea and who already has heart symptoms? Anong nararamdaman nila sa daily routine nila?
It will aggravate, no? Kung ano man yung nararamdaman niya sa heart symptoms niya like chest pain, madaling mapagod, or palpitations, yung mararamdaman mo yung bilis ng pintig ng iyong puso. If you have sleep apnea, parang magnified lahat mga yon kasi you are not allowing your body to rest.
So similar katulad ng sinabi ni Dr. Debbie, so there is irregularity in your heartbeat as well as pagod kayo even after a good night's sleep. So let's move on naman to sleep apnea at ang obesity or yung pagiging overweight ng isang tao. Because several health conditions increase the likelihood of developing sleep apnea, but it's most common in those who are overweight or obese. Dr. Debbie, how does excess weight aggravate that of sleep apnea? We talked about the neck part of it, yung girth ng leeg ng isang taong overweight can contribute to the obstruction properties of sleep apnea. Aside from that, what are other factors that being overweight can contribute to obstructive sleep apnea?
Well, sleep apnea kasi will disrupt yung normal na hormones natin. We have hormones that will tell us that you are full, nabusog ka na, that you should stop eating. So, disturbed yung mga ganon, no? Kung palagi kang sleep deprived or hindi maganda yung tulog mo.
In other words, Dr. Debbie, ang excess weight can make someone's sleep apnea worse. And sleep apnea can also lead to increased weight gain.
Yeah.
When we return, we'll talk more about how to diagnose and treat sleep apnea. Your health is our mission. This is MedTalk Health Talk on CNN Philippines.
Ang Riverside Parts Master Incorporated na sa ilang bagong location sa Dalan, Burgos ning atong syudad. Mahimo niyong tawagan sa telephone number 231-7478 or 826-3663. Mga produkto nga inyong mapalit, genuine, Makita Power Tools sama sa planer, drill, grinder, Triton paints, construction supplies, angle bars, flat bars, GI pipes, automotive spare parts, Firefly electrical devices sama sa switches, bulbs ug outlets. Adto ang Riverside Parts Master Incorporated sa ilang bagong pwesto sa Dalan, Burgos ning syudad. Makahangyo ka o makabarato pagyod diha sa Riverside Parts Master Incorporated.
Pangita, ang labing barato ng mga paraliton labi na sa mga nagananin ng mga pahinanglan gikan karon. Kini imo mapalit diha sa Absolute Essential Traders Incorporated. Absolute Essential Traders Incorporated mara karon ang gihugupan sa tanan ng mga suking pamapalit labi na sa mga katawhan gikan sa Isla sa Dinagat, Surigao ug Bocas Grande. Ang Absolute Essential Traders Incorporated ang aking maymutang sa Dalan Rizal, Kanto Amati, Siyudad sa Surigao. Absolute Essential Traders Incorporated.
Kugon Health Alert.
Akong benepisyo nga nakuha sa Kugon capsule, dakan ko gibati, haway akong likod, buton. Sukan nga nakasuway ko nga Kugon Herbal capsule. Okay magayo, mga iskasimana na ako nga pag-inom. Okay tayo ako ang mamati na. Hard worker gyud ko. Di ka ako na litay babiyon, sakit-sakit sa palawasan. Kan nga nagagamit ko ning Kugon Herbal capsule. Okay magayo. Ako na lang yung ipadayonan. Sobra semana na yun ako nagagamit ko ani. Mayo man ang alibyo, mayo resulta.
Timani, basta kugon, lawas mo. Bas kugon, dagan salamat, maing adlaw ka na itong tanan.
Palma Drug, ana mahimutang sa Palma Superstore sa Dalan Borromeo at bang sa Surigao City Public Market. Alang sa mga Surigaonon ug sa atong mga silingang lalawigan, sa atong pagpanginahanglan sa tanang klase sa tambal, di kalidad ug barato pa, bisitahi ang Palma Drug. Palma Drug for cheaper, guaranteed medicine and fast service. Ang Palma Drug, gipanagiyaw gidumala ni Sheila Loren Palma Mijares. Ang Palma Drug jaon ay branch at bang sa Caraga Regional Hospital.
RPN Radio Philippines Network Radyo Ronda DXKS Surigao. Member, kapisanan ng mga broadcaster ng Pilipinas.
Treatment for this sleep disorder aims to normalize breathing as well as bringing oxygen back to good levels. This is all done during sleep and it addresses any underlying health conditions. I'm Dr. Freddie Gomez and this is MedTalk Health Talk on CNN Philippines. We're your connection to healthcare. Now let's talk about diagnosing sleep apnea. Paano ba nalalaman or paano nako-confirm na isang tao ay may sleep apnea? It's because anyone who feels consistently tired or sleepy during the day should consult a doctor to find out why and take steps to address the problem. Dr. Debbie, paano nagiging confirmatory ang isang taong merong sleep apnea?
We have what you call yung polysomnography or sleep study, no? So either matutulog yung pasyente sa isang laboratory and we record how he breathes, how the level of the sleep, may EEG patterns din yun, yung breathing sa abdomen, sa chest. Meron din pulse oximeter na makikita and then may video recording para makikita mo talaga what is happening while a patient is sleeping.
Now let's talk about treating naman. Anong paggagamot sa sleep apnea? Because lifestyle changes are essential to normalize breathing and are your critical first steps to treating this sleep disorder. Now, I understand that maintaining a healthy weight is one way, ano? Pero Dr. Debbie, what are other ways para mas mapababa ang risk ng sleep apnea ng isang tao? Pwede bang pag binago ang sleep position ng isang tao, makakatulong ba ito sa pag-minimize ng sleep apnea episodes?
You make sure that the patient lies on his side, and you can use anything na medyo matigas. Make sure na hindi talaga siya mag-turn on his back to prevent the snoring and sleep apnea episodes. And then also part of the lifestyle modification will be stopping the intake of alcohol, especially at night, no? And then smoking can also contribute to sleep apnea. Those are the lifestyle modifications that one can take.
Okay, so stopping alcohol, drinking alcohol, and stopping smoking can do so many health benefits, and one of them is lowering your risk for sleep apnea and its complications. Now, Ms. Crisel, if the modifications to someone's lifestyle don't improve someone's sleep condition, let's talk about yung mainstay treatment for sleep apnea, or the first line, which is the CPAP machine. Paki-explain sa ating mga viewers kung ano ba yung CPAP.
So, ang CPAP device po is the gold standard for treating sleep apnea. So, what it does, it gives continuous positive airway pressure. So, it's like an airway stent that helps open up the airways during sleep and maintains yung open airways po. So, para po pag natutulog po tayo, tuloy-tuloy po yung paghinga na habang natutulog at hindi po na-istorbo yung pagtulog po natin.
Okay, so advise our viewers, when you see a CPAP machine, it may be intimidating at first, but the benefits that it can give someone who is with chronic sleep apnea will be a game changer for you. So you will be able to feel that well-rested state that you haven't felt in a long time. Ngayon, kapag all of these don't work, there are still some more treatment options for you. Dr. Debbie, let's talk about kapag hindi gumana ang lifestyle change, kapag hindi gumana ang CPAP machine, when is surgery an option now for obstructive sleep apnea?
So, because not all patients will tolerate or will like using the CPAP machine. So, there are other ways that you can treat that, and in children, yung tonsillectomy and adenoidectomy, no, tatanggalin yung mga nakabara. That's the most common cause in children, except if they have craniofacial abnormalities or deformities, no. So meron din yung mga tinatawag na maxillofacial advancement, may mga ilalagay na splint dito sa jaw, or they can operate dito sa jaws natin para i-advance, lumaki yung airway. In adults naman, syempre tatanggalin yung excess fat dito sa throat natin, and there are implants that they can put, yung mga pillars na tinatawag, para kumbaga mag-shrink yung excess.
So ang punto natin dito for our viewers is merong treatment option for any stage of your obstructive sleep apnea. What's most important is ma-diagnose kayo ng tama para yung tamang treatment ang maibigay sa inyo. And with that, we're glad you could join us on NetTalk Health Talk. Thank you, sleep specialist Dr. Deborah Bernardo and respiratory therapist Crisel Pascual. Thank you very much for your time and expertise. Sleep apnea is a common disorder that causes breathing interruptions during sleep, and this can lead to fatigue, difficulty focusing, and it can even lead to serious medical conditions. So, if you are a habitual snorer, a loud snorer, or you always feel tired and sleepy during the day, it's time to talk to your doctor. These may be warning signs and even red flags that you should not ignore. Once you've been diagnosed with a sleep disorder, there's a whole lot of treatments available to help you finally get that sleep you deserve. I'm Dr. Freddie Gomez, and this has been NetTalk Health Talk on CNN Philippines.